Well, I think it's a great question, because I think one of the biggest problems in medical schools and all different fields of medicine right now is poor pain education. So patients don't even understand where their pain's coming from because physicians aren't able to explain it to them. And this actually stems from the fact that many medical schools don't even teach pain education. So the pain specialty, for example, my specialty is physical medicine and rehab, and we talk about function and improving well-being. And then psychiatry talks about pain, but from a different lens. They talk about depression, more of a top-down, as opposed to pain talks about bottom-up, right? So the problem with chronic pain is that it stays around for too long. And why does chronic pain happen? Because usually there's some type of immune issue, immunosuppression, significant stress or trauma that happens for too long. And then someone has some type of injury or insult. So let's say something drops on someone's foot, for example. There's pain in the periphery, and that pain, the body's supposed to just heal and self-correct, and when it doesn't, that's usually a sign that something else is going wrong, which is why the story behind someone who develops chronic pain is very important. So neuroscience is teaching us a lot about the brain and the body and the whole transmission of pain. So pain is sent from the periphery to the spinal cord, and then there's a lot of different inflammatory mediators that enter your central nervous system that causes neuroinflammation, that then leads into parts of the brain like the prefrontal cortex or the limbic system, which deals with how we sense pain, our emotional experience, as well as our executive function. If we're going to move our foot away, for example, or if we're going to do something about our behavior because of the pain. So the problem that we're having is we have too many people that are in chronic pain, and their bodies are not correcting it for themselves. And the problem is that we don't have good medication to stop pain that stems from the central nervous system. So there becomes a sensitization in the nervous system where then the person not only has chronic pain, but they also feel depressed, or they can't sleep, or they have fatigue. And a lot of this has to do with their lifestyle prior to the injury, what was going on in their life. But either way, if the patient doesn't understand why they have chronic pain, then they're not going to be able to have any hope to get better. And so there's a huge component of us understanding where pain comes from, but then also having better modalities to understand if the pain is now in our central nervous system, we can't use medication that treats things in the periphery. And so there's a lot of great psychedelics that could potentially, and even cannabis, that could potentially take care of pain that is now living in the central nervous system. And then the patient just becomes in a state of fight or flight. And so the sympathetic nervous system becomes activated, and they're not really able to change their thoughts, their feelings, their behavior. So it becomes a full body, not just mind and body, but actually a soul or spirit connection as well. And that's kind of the beauty of psychedelics, is it really taps into everything.
Thank you for that.